Konnichiwa, Dr. Braces here. Thank you so much for tuning in. Today we're going to talk about how in certain situations, certain cases, obtaining a perfect result may not be obtainable. Now, the orthodontist that you go to is always going to strive for perfection, but there are certain instances where we may have to accept compromises in a case. Certain examples of that would be, let's say you have a very significant bite discrepancy and it's not a matter of moving your teeth around, it's more that your skeleton didn't develop properly. Where you need a jaw surgery to correct your bite and correct the position of your teeth and correct the position of your jaws. Sometimes a patient doesn't want to go through jaw surgery because that's a pretty invasive procedure. Sometimes a patient's insurance doesn't cover that jaw surgery. Sometimes the cost of surgery is too much. In certain instances, a jaw surgery may not be something that we can pursue. And so in that case, I will sit down with my patient and I will say, we can achieve a perfect result, but it's going to require a jaw surgery. And I explain what that all entails. Usually I will actually even send in for a consult with the oral surgeon so they can have all the information. And if jaw surgery isn't in the cards, then we sit back down together and I say, okay, we can improve on a lot of different areas. We can straighten your teeth, we can close all your spaces, we can get your bite a little bit better, but without surgery, it's not going to be perfect. And so we're going to have to accept certain compromises in this case where it's not going to finish ideal. Another example is someone that's congenitally missing teeth. Congenitally just means they were born without teeth. And so if you have a patient that, for example, needs implants and they don't want to do implants, that's another situation where you're going to have to accept certain compromises to the bite. The bite may not be perfect. A good example is if you're missing a lower incisor. Lower incisor being one of the front four teeth. If you're missing one of those teeth and you don't want to do implants, then when we finish your case, you're going to finish with what we call overjet. And that just means your top teeth are out too far in front of your bottom teeth. So the ideal is 2 millimeters, but if you're missing an incisor, those bottom teeth are going to be set back a little bit. You can't get it perfect if you have your canines in class 1. And so that's a compromise that you have to accept if you're missing an incisor. So those are examples of cases where you're still going to improve the case drastically as the orthodontist, but there may be a situation where you're not going to get it to perfect and ideal, particularly the bite. Almost always we can straighten the teeth. We can make the smile better, but getting the bite right, getting the teeth to fit together the right way is sometimes challenging in cases where we either need surgery or implants or there's missing teeth. So now I personally will never look at a case and say, yes, this orthodontist did a good job, or no, he did not. And the reason is I wasn't there at the beginning of treatment. I didn't see where that case started. So what we do in that scenario is, believe it or not, I mean, I've had patients come in for consults and they tell me, I went to a previous orthodontist, I want to know your opinion. And I can tell they're looking for me to throw that doctor under the bus so they can go back and demand for their money back, or so they can maybe file a lawsuit against that orthodontist. I'm never going to put any doctor in that situation because, again, I wasn't there from the beginning of that case. I don't know where they started. I don't know what conversations were had prior to starting those braces, prior to starting that Invisalign. I don't know how compliant that patient was. And so in those situations, I am never going to say yes or no, this orthodontist did a bad job, because again, I don't have the full story. And I'm going to give you one example of that, a case that I want to share with you where I didn't finish the case perfectly, but we knew going in before we started that was going to be the case. This is a case where we finished this patient in this position. I don't have the 2 millimeter overbite that we talked about. I don't have the 2 millimeter overjet that we talked about. The canines are pretty close to class 1. It's a little bit off on the left side. You could look at this from an orthodontic standpoint and say, the orthodontist didn't really do a good job on this case. So this is where this case started. In the consultation, I told this patient, are not going to be able to close this open bite completely without surgery. Did not want to do surgery. That was not on the table. I told her, hey, listen, I can make your teeth straight. The bite probably is not going to be perfect, but we can at least make it to where you're happy with your smile. Teased about her teeth her entire life, and so for her, that was exactly what she wanted.
So we knew going into it that it wasn't going to be the ideal finish or the ideal result. So again, this is why I'm never critical of another doctor's work, because I don't know where that case started. It could have been a very difficult, challenging case that you got a good result. So when we look at when we started, this was her smile, and she hated it. She absolutely hated it. And when we look at where she finished, her smile, once we finished the orthodontics, again, the bite's not perfect. The midlines are a little bit off. There's some things we didn't correct all the way, but we knew going in that without a jaw surgery, we weren't going to be able to get there. And so she was thrilled with this result. When we took her braces off, she was crying. She was so happy. She had never loved her teeth. She always felt subconscious about them. She felt like, just hated about herself. And this was the first time that she had seen her teeth in a light where she could be happy about it and she could be confident about it. And so, example of orthodontically, did we get it to 100% perfect? No, but we kind of knew going in it wasn't going to be the case. Did the orthodontist do a good job on this case? I think so, because we took something that she didn't necessarily feel happy about herself, didn't feel confident in, and we turned it into something that she could be confident in. And so that's a situation where, like I said, I never judge kind of like the end product on a doctor's work, because I don't know where it started from.
So that is a great example of a case where we didn't get to the 100% ideal that we're always shooting for, but still a great result. Patient was very happy. I was happy with the results there. We did a service that we could both feel good about. Sometimes the goals you're trying to reach and achieve, I try to be very upfront in cases like that and just let them know, hey, listen, we are going to improve things significantly, but is it going to reach that ideal perfection? No, it's not, unless we do surgery, unless we extract teeth, things like that. And so as long as your orthodontist is being upfront with you early, calling it what I call a compromise case, meaning it's not going to be perfect, we're going to have to accept some compromises, and going in that that's going to be the case, then you can still feel confident that your orthodontist did a good job on your case. It's only situations where maybe the orthodontist didn't mention that there's things about this case that may not finish perfectly prior to starting, where you might be able to be rightfully upset if those conversations weren't had beforehand. So very important to understand the difference between shooting for ideal versus accepting compromises. And in certain cases, you just have to do that. I have another example of a case where the patient, she's missing 2 lower incisors. She was born without them. She doesn't want implants. And so we're trying to get these teeth to fit together in a way where the bite feels good to her. And she keeps bringing me pictures of Korean supermodels and saying, I want my teeth to look like this. And I keep having to explain to her, you are missing 2 teeth on the bottom. Your teeth are shaped differently. They're not going to look like that. It's not something she's been able to accept or understand. And so it's been a bit of a challenging case. But we have to just keep in mind that every case is different. Every patient is different. And there's certain instances where you have to struggle to get what you want and what you need. But there are instances where we have to accept some compromises, because unfortunately, the deck you were dealt, it doesn't mean you're going to be able to get that perfect ideal result.
So in that situation, when a patient comes into a consultation, I will explain, these are the steps that we need to take for this result to be perfect. Whether it's jaw surgery, whether it's implants. And if the patient comes back to me and says, I can't do these things, then I'll explain to them, that's fine, right? That's fine. Don't worry, we can still improve upon things. But if we don't do the surgery, you just have to understand that it's not going to finish with the ideal bite. And a lot of times they're willing to accept that, because they see things about their teeth or things about their smile that they're not happy with, that they don't like, and they just want me to fix those things. And so again, when I have these conversations, it's just important to have them before treatment starts, so that you totally understand where we're willing to accept these compromises, where we have to accept these compromises. Again, my goal is to just always give all the information so that the patient can make the most informed, educated decision on their case, and so that we can do the right thing by them. I hope that was educational for you. Thank you so much for tuning in. If you're interested on how do braces move teeth, click here. And remember, smiles change lives, so keep smiling.